Florence is a way for me to communicate with my patients in a really quick, easy format.
So we hope that Florence will help empower our patients.
She's a text, that's all Florence is. She's not a human being, but she is a support mechanism.
Florence is a home mobile health monitoring system. She sends texts and she receives texts. Clinicians can see the information Florence gathers on their screens. Susan McNaughton lives in a village in Perthshire. On the advice of her GP and with the help of a dietitian, she is gradually reducing her weight.
She texts you once a week to remind you that you're going to weigh yourself the following morning. She texts you in the morning, she asks you to give her your weight. She's that friend that you'll tell your weight to, because you, as an overweight person, I don't even tell my nearest and dearest what I weigh, it's none of their business. And I probably wouldn't have looked at the scales anyway if I wasn't doing this. So she forces me to see what weight I am, and I tell her, and I don't mind telling her.
Jacqueline Walker is the manager of the Tayside Nutrition Managed Clinical Network. She's keen to encourage more use of telehealth solutions, like Florence.
Within the new modern outpatient programme, that's very much part of what we should be doing. So it's about allowing and providing the person themselves the skills and tools to allow them to self-manage. It's also about doing things differently. So, we have traditionally had clinics, and we have people back at clinic on a routine basis. A lot of these people don't necessarily have to come back to clinic if we can do it in a different way. And that allows the clinic time to be freed up to see more urgent patients quicker. So there's a benefit there for the NHS and for the population as a whole.
Alison Marshall is a specialist dietitian working in cystic fibrosis. She uses Florence to help undernourished people gain weight.
I find it really useful. They'll get little nuggets of information that will help them to adapt their eating behaviours and their habits around what food choices they're making.
Lisa Bonthron does the opposite from Alison. She helps people lose weight.
I suppose the struggle can sometimes be keeping motivation levels up long term, because our programme is actually a 1.5 year long programme and motivation levels can dwindle. So we hope that Florence will help empower our patients.
Dietitians Alison and Lisa clearly like using Florence, but has Florence added to their already heavy workload?
I don't think it's extra work at all. I think when I first talked about it at our team meetings with our team, there was a bit of resistance there because they were worried about how long it would take to add their patients. Certainly my experience, and when I've showed other clinicians in the team how to use Florence, they've been pleasantly surprised that it really doesn't take as long as they originally thought.
Florence is already in use in Lothian, Highland, Lanarkshire, the Western Isles and many other areas. The Tayside trial of Florence includes weight management, smoke-free pregnancy services, oral nutritional support, heart failure and hypertension.